Awesome. How's everyone doing this afternoon? You don't realize it, but I'm secretly practicing my upcoming stand-up routine on y'all. So here's the topic of today's session. What's new in efforts to provide information on antibiotic use and resistance to different audiences with varied interests? And so that has everything to do with the picture I'm showing you right now. So Dr. Apley, I know you're there in the back. You can probably not see this very well. I'll flash over, but there's this little thing in the corner. You guys over here, you can phone a friend. I'm not very good with the laser pointer, but right there, what is that? So there's a windmill, but the little metal thing next to the windmill. What is it? Water tank or stock tank, right? But where I come from, this is the view out my parents' back porch. That's our swimming pool. You think I'm joking, but it heats up really well in the New Mexico sun. So, and around communication, so I bought my parents a cell phone. They live in rural New Mexico. Their the nearest town where I went to school is about 40 miles away. And I wanted to be able to reach them at any point in time because, you know, they're I don't want to say that they're getting older, but they're getting more adventurous in their old age. And so I got them a cell phone, but the problem is the Ortiz Mountains, which their house backs up against, interferes with the signal. And so I said, well, you know, Dad, I tried really hard to get the cell phone. It'll work in town, but it might not work on the mountain. So I get this email one day from my dad. And my dad said, and the subject is, look who's connected now. So my dad is an ingenious guy, and he had rigged, this is the top of their house, that's the picture on the right, he had rigged his own repeater for the cell phone signal. And I'm pretty sure that the cell phone company is going to be soon asking to borrow it to generate the rest of cell phone signals. But anytime I try and communicate with an audience, this is kind of what I think about, right? It's where I grew up, it's my neighbors, it's my parents, and how is it when we have an outbreak of illness or something going on with antibiotic use or antibiotic resistance that we want to communicate? How is it that I get this information to them, right? And how is it that with these varied interests, you know, some people say that's a stock tank, it didn't have algae in it and the cows didn't drink out of that one, that was a swimming pool. We have very, very different ideas and thoughts, so that's where I'm coming from. And so today, I'm going to talk a little bit about the communication during outbreaks of illness that are linked to animal contact. And I'm going to use examples of both a food-producing animal and companion animals. So every single day, we are bombarded by crisis and risk communication. It's part of our daily life. And I think this picture is a really good example because there are multiple communication messages there, right? The red and blue flashing lights. Many cities and jurisdictions are not allowed to use that color of light because it signifies an emergency vehicle or other event is going on. Now, ignoring the Christina's Pizza piece, what you'll see above that is a sign that says drinking kills driving skills, right? So another public health message about drinking and driving. And this information is essential to helping us live healthy lives in many ways, right? But how do you ensure that your message actually gets out there in a way that is doing what it's intended to do? And that is to help people, in my line of work, make decisions about healthy choices, right? So, lo and behold, we have a whole process behind how we communicate regarding an outbreak. And these are foodborne outbreaks, these are outbreaks of animal contact, and these also include information about antimicrobial resistance or resistant organisms that are found during an outbreak that might have an impact on how we treat a patient or how we potentially or why we are potentially concerned about a specific pathogen. Okay? So this process is in the interest of transparency. My name is Megin. Yes, I'm a millennial. We have this whole website that's out there that talks about when we communicate, why we communicate, and how we communicate. Okay? So one of the top things, warning consumers quickly about contaminated food can save lives. Right? That's something these messages can do very, very well. But we have decisions that we need to make before that communication actually occurs. And this is one of the biggest things that we're weighing, right? The risk of a health event and the communication about that risk is related to the hazard, so the actual hazard of, say, a contaminated food product or contact with an animal that might be shedding a multi-drug resistant organism, and outrage, right? What is the outrage of the public? What is the outrage of the consumer? What is the outrage of the industry sometimes? What is the outrage of my dad when his cell phone wouldn't work? It was pretty high. So let's use salmonella in backyard poultry. Okay, this is a pretty significant food source for people not only in other countries who might not consider them backyard, but also a lot of people in urban and suburban areas use these animals for fresh eggs. So here's our communication from 2017 regarding the multi-state outbreak of human salmonella infections linked to live poultry in backyard flocks, okay? So you can see we have a couple things. We have a map, and that conveys information pretty quickly. This is not something that's isolated to a particular area. It is all across the country. Up at the top, we have the summary. So we have the number of people who got sick and the number of states, the number of hospitalizations. So you can see that relative, if you're looking for severity, and the number of deaths that have resulted, okay? And if you were to read down the page in this post, you would see that there is no information on antimicrobial resistance because this particular outbreak did not have salmonella that was resistant to medically important antibiotics. That's great. Okay, so we investigate the outbreak, we have the data, we make a decision that we need to communicate to backyard poultry owners about this, and we want them to stay healthy, right? On the right-hand side, tips to stay healthy. And from that, we generate an infographic because we know this is one of the most effective ways to communicate. And I have to say, I was very impressed by the McDonald's presentation because what did you see? A picture and a number, a percentage, 65 million meals served, those types of things, they stick in your head. So that's how we try and communicate because, yes, we're going to communicate, we made the decision, let's make it effective, okay? So, healthy families and flocks. We are not trying to scare people to say, you will die. There is an outbreak. It is bad, right? There is one death and over 1,000 infections. All right, that is very serious. However, what we want to do is keep people and their animals healthy. How do you do that? Hand washing, number one, so simple, right? Handle the birds safely. You got that picture. Clean the coop, right? And poultry belong outside. They don't belong inside with us. Great. Okay, so we have the data, we've announced the outbreak, and now we have this great infographic. And here's what appears in the media. Okay? So I have a lot of moments of self-reflection when this happens. And my parents put this on the refrigerator. They still do that as though I were 5, and I kind of appreciate it. But the piece that actually came out in the media was actually telling people not to kiss their chickens. So of all the data and all the information that we presented about how to have chickens in your backyard, maintain them safely so that you and your family can enjoy the animals and stay healthy, this is what came out. Okay, lesson learned. This went viral. It contained the links to our webpage, so that was a good thing. It was driving people to actually read the information. But the message most people got were don't kiss their chickens. And to be balanced, the media actually interviewed people who enjoyed kissing their chickens to provide a balanced reporting. Now, what does it look like when the consumers get involved? So not only are we putting the message out there, we're also looking at what comes back. And we have a really, really great communications team that is actually looking at the tweets, the comments, the media response. How many website hits did we get after it went live and in what time frame? Now, this came off of some of the comments from our website. So I removed, in the interest of protecting the innocent, I removed the names of the posters. So in this one, I add oil of oregano to the drinking water from day 1 for the first month of the baby chick's life. Never had a problem losing any sick baby chicks, all very healthy. I keep them separated from the rest of the flock for 2 weeks. Guess what? They got some of our biosecurity messaging. Yes! Does oregano truly prevent salmonella? Tasty chicken, perhaps. So some of that message is retained. All right, down at the bottom, and this will get much, much worse when people cannot buy antibiotics for their flocks. As of the 1st of this year, you will have to take your poultry to the vet. Ha ha, yeah right. The closest avian vet here is 200 miles away. And so this is a comment about antimicrobials and what they think about antimicrobial use in their backyard flocks, right? Interesting. They got the message and maybe went to the link that talked about why you cannot use Baytril in your backyard chickens and why they're actually still food animals, despite having names, wearing diapers, and maybe having leg jewelry. Right? Could you please private message me a state that is safe to purchase meat chicks from? We need chicks that are salmonella free. My little one loves to hold all of our chicks and love on them. We don't use antibacterial soap in our house or hand sanitizer. Okay, so there is an example of messaging that was missed, right? And what can we do? How are we continuously striving to message to this varied audience? Okay? So let's talk a little bit about the companion animal industry. So this is a multi-state outbreak of multi-drug resistant Campylobacter linked to pet store puppies. So this one is actually had a multi-drug resistant component. So we're going to compare that to the chickens. Here are the scientific conclusions. Large multi-state Campy outbreak linked to dogs. No single source of infection likely disseminated throughout the industry, meaning we didn't get it back to a particular breeder or a particular breed of dog or a particular facility. The outbreak strain is resistant to common first-line antibiotics used to treat Campylobacter infections. We are making a statement, and there's a message that is evidence-based about antimicrobial resistance, and it highlights the need for ongoing antibiotic stewardship, right? Okay, here's the posting. That information was included. You'll see there's a map there. Something similar with respect to the number of cases and hospitalizations. So, does anybody remember about how many hospitalizations were in that last one? 200? Okay. Now for salmonella, that's pretty average, right? Number of hospitalizations, especially given kids that get sick for salmonella. For Campylobacter, however, this rate of hospitalization is very high. This is above what we'd expect. Fortunately, there were no deaths. But one of the things that, if you scroll down in this one, you'll notice the antimicrobial resistance piece is much higher. And why? Because if a physician or someone wants information about the outbreak, they need to know that not only could this be something that they want to look at, they also want to make sure they're doing susceptibility testing. So there's a link in there to message to physicians about this. All right. So let's talk about the science behind that. Why would we decide to put such priority on antibiotic resistance in this message? All right, so here's a whole genome sequence tree. I think this is going to be interesting. So I have, these are the people who got sick who had some isolates available, Campylobacter isolates. And they're the little black human emblem. And then we also had dogs from whom Campy isolates were available from their poop. So they're there. These were all involved in some way, shape, or form in the outbreak. And across the top is a list of antimicrobials that we test for when it comes to resistance. And so we're going to look at the whole genome sequencing. And I'll tell you that the resistant infections are going to be in blue, and the ones that are susceptible are in yellow. So when I click next, what is the proportion of blue to yellow going to look like? More blue or more yellow? Any guesses?
For Campylobacter in this outbreak.
For Campylobacter. For this, more yellow, right? More susceptible to antibiotics. Okay. If I had a plastic mic to drop it, this would be the moment. This is a bad day at CDC. This is why the message there that we conveyed took very, very high priority. Because not only are the isolates that are coming out of people multi-drug resistant to all the first-line treatments that we would reach for, if someone had a severe enough Campylobacter infection that it needed treatment, it's the same way in the puppies. Okay? In a person hospitalized with Campylobacter, are we going to isolate and then do susceptibility testing on that bug? In a person? Yes. What about a puppy? Or are we going to reach for something off the shelf if they require treatment? So The messaging from this, if you were to look at our sequencing, and I'm presenting to a scientific audience, we had the same resistance across all the clades that we saw in whole genome sequencing. We observed the same resistance in human and puppy isolates, and the predicted resistance and antibiotic susceptibility testing. So the genomic piece, where we're looking at what type of genes might convey resistance, and then the susceptibility correlated well. So the two types of testing correlated well. So where is this coming from? So we have the resistance piece. How do we communicate about the use? Well, if you actually went through the records for some of these puppies that were located at pet stores, and you looked at the indication for administering antibiotics, you would find that 5% of puppies received no antibiotics out of 141. 1% received antibiotics for treatment alone. Over half received antibiotics for prophylaxis, and 38% for treatment and prophylaxis. That's why it's so important to convey information about use and why we're recommending stewardship. What antibiotics are used? Nitromidazoles, metronidazole at the top of the list. And this is by the number of days administered, or what we were referring to as dog days. What about phenocols and aminoglycosides? Is that something that we usually use to treat Campylobacter infection? Would you give it prophylactically? What kind of messaging should we convey about use? So here's our messaging that we decided to do, and talk about varied audiences. Pet owners, simple, hand washing, sanitation, and when to seek veterinary care. Pet store employees who are getting sick, hand washing, sanitation, wear gloves, don't store your lunch in the same place as you store the puppy poop. Healthcare professionals, antibiotic resistance, case management, and avoiding antibiotics to which the outbreak strain is resistant. And veterinarians, this was a new one for me. How to test for Campylobacter. It's not something that is part of your routine everyday workup. Okay? But we also wanted to message about the importance of the human-animal bond. So we did that too. And we worked very closely with partners at organizations that message well to veterinarians. Veterinarians go to their website. Should I get a pet even if there's a risk it could give me a disease? Right? We use this to highlight some of the ideas about why stewardship is so important. And when the articles for this came out, they were pretty effective. Puppies linked to bacterial infection outbreak across 12 states. Puppy dog eyes can be adorable. Puppy dog love can be sweet. Puppy dog bloody diarrhea, not so much. But this was a new one. So we have another audience. Poopy puppies poisoning people. This is the Marler Clark law blog. How do we message to that group? Might be a little different. So for that, thank you so much for your time, and I'm looking forward to questions that we get as part of the panel.